breast cancer is a major concern of adult women. So it's good to know that the leader in breast health services in the Midwestern region is right here in Cleveland at University Hospitals. But how did they take the lead? Dr. Donna Plecha has joined us in the UH Broadcast Center to tell us. Dr. Plecha is a director of breast imaging at the Breast Health Services inside Cancer Center here at University Hospitals. So welcome to the show.
Thank you.
Now UH stands out in this area because your program is value-based. So what does that mean?
That means that we are patient-focused on each individual patient, and we treat patients individually depending on what's best for them.
Okay. And you have a whole team of doctors that help the patients, don't you?
Yes, we do. Once a patient is diagnosed with breast cancer, we have a team including radiologists, surgeons, oncologists, radiation oncologists, geneticists, plastic surgeons, and social workers that all help us with the patient's journey.
Okay, so it's all about the needs of the patient throughout this breast cancer issue, right? So how do you do that?
Well, we actually have a conference weekly where we talk about every single patient that's diagnosed with breast cancer. We talk about what's best for that individual patient, look at all the studies that are open at university hospitals, and see what the patient may benefit from.
Okay, so can you give us some examples of how that works with patients?
Well, if there is a specific study, let's say if a patient has receptors on her breast cancer that are triple negative, we may have a study specifically for that, and so we'll lead her that way to see if that's something she might be interested in doing. We have a study currently where we're looking at different types of MRI sequences to see if we can predict response to preoperative chemotherapy. So there's many different options out there for different patients.
And some patients are kind of nervous about the whole thing or can't get to their appointments and stuff. So how do you serve those people who are having trouble kind of getting into the whole swing of the breast cancer checks and what needs to be done?
Well, once they're diagnosed, there's a navigator that helps them through and get to all their different appointments. And everyone works as a team so that it's everybody knows what everybody else is doing for that patient's care.
Is there a way to get fast results for people who are a little nervous about what's going on?
Well, on the screening side of things, before the patient is diagnosed, when a patient is just getting her screening mammogram, we have a couple of different options. We have an option where the patient can come in, and if she wants her results right then and there, she can wait. And approximately 30 minutes after we take the mammogram, the patient gets her results in person before she leaves the breast center. And then if she needs any extra imaging, we may be able to do it on that same day.
Oh, that's handy.
It is.
And you have drop-in appointments?
We also have some walk-in appointments at most of our sites, so it's great if a patient is just kind of near one of our sites. If they want to drop in and get a mammogram, we're happy to accommodate them.
Okay, and you've got a particular study going on right now?
We do have a study right now that is on the screening side. So patients who have dense breast tissue, there's a national study, and we're one of the sites in the study looking at a 10-minute or less MRI and comparing that to the 3D mammogram and seeing which one might pick up cancers more. Smaller cancers or more aggressive cancers, and we're trying to get patients to come in with dense breasts. They'll get both the 3D mammogram and the 10-minute MRI exam of the breast on the same day.
All right. University Hospitals is leading the way in breast health services, and their innovative services and continuing research demonstrate that they're committed to remaining a leader. To learn more, use the information that's coming up next. And my thanks to Dr. Plecha for joining us today.
Thank you.
For more information, call the Center for Lifelong Health at University Hospitals at 844-312-LIFE, that's 5433, or visit www.uhhospitals.org/lifelonghealth.